Hi, everyone. I'm Brittany Morrison, and I am so excited to be your host today for a very important conversation, a collaborative panel where we discuss what curative care looks like in Central Texas. And we have Texas Oncology, Wonders and Worries, and Austin Palliative Care here today to weigh in and provide their very valuable insights. But before we begin today's conversation, I want to tell you about a family. A 42-year-old mom of 3 was diagnosed with stage 2 breast cancer. Her prognosis was hopeful. Her oncologist used the word curative, and that word became the anchor she clung to. Surgery was scheduled quickly, chemotherapy followed, and calendars filled with appointments, infusion days, scans, and lab work. At home, though, a different story was unfolding. Her 10-year-old started having stomach aches before school. Her 15-year-old stopped asking questions or engaging in conversation altogether. Her 6-year-old began sleeping in her bed every night. The medical team was doing exactly what they were trained to do and were aggressively treating the cancer, and they were doing it well. But there are so many other tools related to curative care outside of aggressively treating cancer. Tools through palliative care that could help manage her exhaustion and anxiety while she pursued care. Tools for supporting her children's understanding of illness and for building emotional resiliency in the home. Tools found through collaborative care. Her oncologist introduced palliative care early to help manage symptoms. A referral was made for child and family support, and suddenly the care plan expanded beyond the tumor. It included quality of life, it included communication, and it included the kids. Today's panel discussion highlights how this type of collaborative care that is happening in Central Texas right now for families facing cancer diagnosis and what that can look like during curative cancer treatment. And now I'd like to introduce our panelists. Today, we have Dr. Yao of Texas Oncology, and she joined us here to share a little bit more about the typical clinical care provided here in Central Texas. Dr. Yao, could you please introduce yourself?
Yeah, hi, Brittany. Thanks for having me. I'm Dr. Courtney Yao. I have been a practicing medical oncologist for a little over 15 years now, been with Texas Oncology for 10 years. My clinic happens to be in the Georgetown location. We are located all over the greater Austin area in multiple different clinics spread out. And we are generally community oncologists. So that means we see all types of adult cancers. But a lot of us will, kind of focus on a particular thing that we have a special interest in. Personally, I have an interest in breast cancer, so that tends to be a majority of my practice. We see all different types of cancers. We offer a comprehensive practice. We give chemotherapy, infusional therapies. We have radiation oncologists, many surgical subspecialties with Texas Oncology, and we really enjoy working very closely with our palliative care providers and, of course, Wonders and Worries, who is a wonderful organization that we've collaborated with for years.
Thank you so much. We also have Tatiana Sokolik with Wonders and Worries. Tatiana, could you give a little introduction too, please?
Hi, I'm Tatiana Sokolik, and I'm the Central Texas Outreach Coordinator for Wonders and Worries. At Wonders and Worries, we provide free support for children when their parents have an illness or injury, and I collaborate really closely with Austin Palliative Care, Texas Oncology, those referring providers, school counselors, so that everyone in our community, as many people as possible, know how to seamlessly connect families to us so they can access our support.
Thank you. And last but not least, our final guest today is Diana Wagner, representing Austin Palliative Care for today's discussion on curative cancer care. Diana, could you please give us an introduction?
Yes, thank you for having me. I'm super excited to be here and to continue to work alongside you guys. So my name's Diana Wagner. I'm the Director of Education and Training at Austin Palliative Care and Hospice Austin. We provide services to people with a terminal diagnosis within the Travis County area. And we provide support, an additional layer of collaboration, care, and oversight for patients and families who are navigating their diagnosis and their symptom management.
Great. Well, let's dive in a little bit and talk about what curative disease is. And we are so grateful to have all of your different expertise shared in this discussion on what collaborative care can look like for curative disease. I think to start out in this conversation, we should first start with an explanation of what we mean when we say curative disease. So I'm going to turn it over to Dr. Yao to better explain what we mean by curative disease, what we mean when we say a patient is receiving curative treatment, what does that typically involve, and what are patients balancing during that phase of treatment. Dr. Yao?
Sure. Thanks again, Brittany. So, in general, we consider cancers curable if they're diagnosed at an early stage. So, specifically, if the tumor is still in the site where it originated, or maybe even has a little bit of local spread, maybe to some local regional lymph nodes. But oftentimes, if it's diagnosed at that stage, then, our goal is to cure this. But, it can be very scary, daunting diagnosis. And it can be very overwhelming. Typically, in order to cure a cancer, we're looking at surgery for a lot of solid tumors. Lymphomas a bit different, but people are meeting with surgeons, medical oncologists. They may be hearing about chemotherapy or infusional systemic therapy. Sometimes radiation oncology is involved and required to, give patients the best outcomes. So it's a really stressful time. There are many doctors they're having to meet. There are scans that have to be done. And there's this waiting period. It's this time of unknown when they're waiting to see the providers and get their scans. We don't always know the stage right up front. And so that can be very hard on people having to wait for weeks and very stressful. And then, it takes a little while for us to also get all of the puzzle pieces put together to be able to tell them this is the treatment plan. And then all the while, they're probably nervous about, well, how is this going to impact my work, my family? They're oftentimes concerned about the financial burden of treatment. And so it's difficult up front, even for those curable cancers. It's a very hard time for people and their families.
Yeah, that is a lot to be holding all at one time. Thank you for explaining that. I think it would be great if we could talk about how to establish early collaboration. And I'm going to ask each of you, if collaboration is working well, what that looks like. Can you kind of define success for us? And Dr. Yao, I will just go ahead and start with you, and then I'll move on to get the feedback from everyone else.
Yeah, thank you. I think it's, imperative that you have a good, close relationship with the providers, the whole team. Cancer therapy is not just doctors and nurses. It's social workers, case management, palliative care, child life specialists. All of those people play a huge role in supporting our patients and their family. When you have a close relationship with the whole care team in the community, the handoffs and collaborating are pretty easy and I think seamless for the most part, particularly with palliative care and Wonders and Worries. At Texas Oncology, we have it set up where the doctor just puts an order in, and then our scheduling team reaches out to these caregivers. And it's been a very seamless, easy method of sharing our patients thus far. It's been like that for years. And they know that, they can always reach out to us too. I think we have it set up very well in the Austin area to be working together.
Wonderful. Thank you. Tatiana, could you talk about what success looks like in early collaboration?
Definitely. We love our partnership with Texas Oncology, and they send their families to us right away. Our child life specialists are able to help guide the family through those initial conversations that parents will have with their children. Collaboration with Wonders and Worries, it looks a lot like what Dr. Yao just mentioned. When she refers a family to us and we're connected as close to diagnosis as possible, we're really able to support that family before maybe some of the stress factors that children might face arise. So when Dr. Yao refers a family, one of our certified child life specialists will reach out to that family within a few days. They will learn what diagnosis the parent has. They will learn about treatments and kind of what that journey looks like. And then they will start having one-on-one sessions with the children in the family. And those can be done virtually or in person at one of our offices. And the children will meet one-on-one with a certified child life specialist. And these are medical professionals that are trained in educating children in what's going on in the body. And they know how to talk to teenagers and children and really make it developmentally appropriate for all those ages. Some children really like to get into the details of what are the cells doing. Others like to keep it a bit broader, and our child life specialists will meet the children where they're at. Our 6 sessions, they start with the child life specialist bonding with the child, building that trust. And then they move into education normalization. What is going on with your parent's body and what is their illness? What do the treatments and side effects look like? Will there be surgery down the road? What does that all look like? And then the child life specialist will move into communication. They hold space for the child to communicate and also give them tools to continue communicating, because sometimes children can shut down in these situations and not really know how to talk about it. So they're given the tools to continue communicating with their family. And it moves into coping skills. The child life specialists help the children to understand what coping skills work for them. And it's different for everybody. And they will build a coping kit together of little tools that they can take with them to school or the hospital, wherever they're going, so that they always have these coping tools to fall back on. If something upsets them in the moment, they can fall back on those coping tools. And then it ends with building a wish tree, which is one of the most beautiful things that the child life specialists create in our sessions. And they help the children make wishes for the future, say what's going on right now, what do they want to have happen. And it's just a beautiful artifact that they can take with them. So that is the course of our 6 sessions. But after that, we always want families to stay involved with us, either through family fun events we have throughout the year and through our support groups. We have teen support groups and school-aged, elementary-age support groups, and we always want the kids to stay connected with us and the families to stay connected with us.
Awesome. Thank you for explaining all of that. I know it's a very holistic program and provides a lot of support, not just to the children, but also to the caregiver and to the patient themselves. So it's really a wonderful, well-rounded program. Diana, can you answer this question about what early collaboration and collaborative care looks like from the palliative care perspective?
Yeah, I really like to see us as this added layer to sort of support and stay aligned with all of the providers that are involved with the patient and the family. Research has shown that having palliative care involved in the patient's treatment plan early on has better outcomes. They're reporting improved quality of life, reduced depression, anxiety, improved family functioning, and just general patient satisfaction, better symptom management. I think the symptom management is probably the biggest part of what we do. Palliative care, often when patients are seeking aggressive or curative treatments, there's a lot of side effects and a lot of things that come along with those treatments. And so we come in to really help the patient and the family navigate how we manage that nausea, how we manage that profound fatigue. And we're coming into the home. So they will have a team of either a doctor or a nurse practitioner and a nurse, psychosocial support to come into the home and talk about the things that, we're maybe not touching on in offices and during our oncology visits, for example, like how to sit up in the bed or adding a wedge pillow to help you breathe a little bit better. And just little things, tricks of the trade that being an expert in palliative care and being an expert in helping families and patients navigate this illness to make it as comfortable as possible and hopefully providing them with those tools and that support so that they can really focus on their family and focus on what's most important during that time.
And can you speak a little bit to how the referrals are made to Austin Palliative Care?
Yeah, absolutely. Often, we're getting a referral from Dr. Yao or another wonderful oncologist at Texas Oncology, and people are coming to us at really any stage during that diagnosis. So generally, once we receive that referral, we are gathering information from the referral source with some background, what's been going on with the patient and family, learning a little bit more about what the goals are for care and learning about the family. And then we are quickly swooping in, reaching out and setting up appointments to get in there and help them while they navigate that. And I think ideally what Austin Palliative Care provides is just protecting the patient is really physically, emotionally, mentally supported while still being a parent, still being a spouse, still being all of those things during that time.
Diana, you just touched on something that we're about to discuss a little bit more, but kind of that mental health component and how important keeping your mind healthy can be when you're navigating any kind of illness, but certainly a cancer diagnosis. And Dr. Yao, I'm curious, as a provider, what difference does it make, or what impact do you see for patients and families who do have that proper psychosocial support in place?
Yeah, I think it makes a huge difference. Kind of tacking on to what Diana was saying, it's not that medical oncologists don't care about the psychosocial, the how our patients feel, quality of life. We absolutely do, but with the time constraints that we have, priority has to, somewhat be on the cancer, treating the cancer, the chemotherapy, the side effects, discussing those type of things. So I think people that are also being cared for by palliative care have a better quality of life. And I think those people end up probably being able to stick with their cancer therapy more routinely on a regular basis, keeping them on schedule because their overall needs are addressed more thoroughly. Like Diana was saying, nausea, fatigue, insomnia. I mean, you name it. There's all kinds of side effects that come from treatment that palliative care does a very good job at managing. Probably, I would say, a bit better than medical oncology because they're experts addressing and helping those issues. So I think we tend to think of palliative care for advanced cancer a lot of times, but I think maybe we should also be thinking about this even in the curative setting and the early stage cancers because they too are going through it oftentimes. Surgery, the healing from surgery, the side effects of systemic therapy, they too can benefit greatly from a palliative approach. That's my thought on that. I think they're an excellent addition to the holistic approach of taking care of our patients.
Wonderful. Thank you so much. To piggyback onto what Dr. Yao was just saying, Diana, could you speak a little bit more to how supporting that symptom distress can impact a parent's ability to show up for their children? I would say both positively and or negatively, should you not have that support that you need.
Yes. So when we are really focusing on that symptom management, a lot of times we are trying to figure out how we can manage both the symptoms so that there's enough space left in their life to just exist and be who they are and be present and an active participant in their family. We're navigating all kinds of emotions alongside the patient and family with these diagnoses, with their treatment plans. We're navigating things like mistrust of systems, mistrust of caregivers, navigating a sense of guilt, navigating fear, anxiety, and a lot of symptom management. A lot of the side effects of the medications can cause these kinds of symptoms like anxiety and depression, and just fear of discomfort is a big one that we see and help people navigate.
Tatiana, can you talk about how having this medical clarity from providers helps your child life specialist guide parents in the conversations they're having with their children?
Yeah, it's really important for our child life team to really understand the treatment plan of the parent. That way, they can really walk the child through every step. What is the initial treatment going to look like? And then a little ways down the road, will there be surgery? What side effects are there going to be? Will mom be staying in the hospital for a bit of time? The more our child life team knows, the more they can prepare and empower the child.
Dr. Yao, what barriers to collaboration have you found that sometimes exist?
Yeah, any of our team members can refer to Wonders and Worries, palliative care. We have a lot of advanced practice providers, our nurse practitioners, our physician assistants. A lot of times what they will think of this, sometimes maybe when the doctors haven't, because we may be overwhelmed with thinking about, cancer and the technicalities of it all. Nurses can make suggestions, hey, this patient has a young child and we haven't sent them to Wonders and Worries. So, as far as where referrals can come from, really anybody on our care team. I feel like in my personal experience, the biggest barrier, I don't want this to sound wrong, is a lot of times the patient, because early on they're overwhelmed. And so when I'm saying, okay, I'm going to set you up with a surgeon and a radiation doctor, and you got to get scans and this and that, and then I say, and I want you to see palliative care, and there's an organization, Wonders and Worries, that help your children through all this. They already feel so overwhelmed that the thought of connecting with another group or another person, I think sometimes I get pushback on that. Well, okay, that sounds great, but not right now. Let me just get this other stuff done first. So, I've kind of learned to realize that maybe the very first visit, which is oftentimes the most overwhelming, may not be necessarily the best time, connect with these other providers, but that we can bring that back up again on the second visit or the third visit or into the near future. I find personally that that's my biggest barrier, just how overwhelmed the patient feels at the time of diagnosis.
That makes a lot of sense. And I'm also, my thoughts take me to, in a strange way, like a sense of pride of not wanting to accept help. Do you see patients that struggle with that, who I'm sure are mentally and emotionally processing a lot about, being sick and seeking support from other people? And how do you support your patients to the best of your abilities, given all the constraints you're facing as a very busy provider? Can you speak a little bit to that?
Yeah, I think that can play a role, in addition to just feeling overwhelmed. I think, thinking that they can handle it on their own, as I think a lot of adults, have a tendency to feel that way. I think if they just knew how beneficial this collaborative care and these other team members would can be to them, and I think that's our job as medical oncologists to share with them. Look, you're going to get through this so much easier physically, emotionally, if you have a whole team focusing on different aspects of quality of life and the emotional side of this. So I think it's our job to kind of let them know what they're missing out on these resources and just, keep offering it to them.
Yeah. Some people might need a little more of a nudge than others. And speaking to some of the challenges and barriers to people seeking out this collaboration and this more holistic type of care, palliative care, I know, has some misconceptions and a bit of a stigma around it. And I'd really appreciate, Diana, if you could speak to some of the challenges that are presented whenever an MD might suggest a palliative care referral. What are we seeing there, and how can we shift that narrative to help people feel more open to accepting this incredible service?
Yeah, absolutely. Dr. Yao, nail on the head on what those barriers can often look like. I mean, just from receiving the diagnosis, talking about the treatment plan, research shows that people are truly absorbing about 20% of the information that's being given to them during those kinds of visits. And when they're initially diagnosed or when they're initially talking about what that treatment plan is, radiation, surgery, all of these other things, that I think that there's at least a good possibility that they're not even hearing that there's also these referrals that are being made. It's an afterthought. And then there's also the stigma that is still around palliative care. Palliative care, why is Dr. Yao referring me to palliative care? I'm not dying. I'm seeking aggressive treatment. And so I think that really freaks people out. They think that that's a bad term, and the connotations that come along with seeking palliative care to them means giving up sometimes, when it really is like, no, we just know what the road ahead looks like, and we're going to navigate it with you passenger seat, and we're going to help you with all the bumps and valleys and the things that come along with that ride. So those are definitely some barriers. I think they are super busy, and really worried about, like Dr. Yao said, bringing in yet another team, more appointments and things like that. But in reality, we're coming to your house and we're going to sit down with you in your living room and we're going to talk about what Dr. Yao talked about. We're going to talk about all the other things. We're going to figure out what other resources in the community you might need, benefit from, are eligible for. We're going to talk about the medications that you're being prescribed, and we might be prescribing some medications to help with some of those side effects. All kinds of support from a medical aspect and a psychosocial aspect. So that's a big barrier, I think, is just the stigma around palliative care and what people think it is. And then just, the energy that it takes to even fathom bringing on more people into the team.
Yeah, that all makes total sense. And I think as someone who's been in a caregiver role myself, there's so many moving parts, just the insurance piece alone is a full-time job, but even just trying to get the proper equipment for your loved one and where to find that. And Austin Palliative Care has been a tremendous resource. And for my family, procuring the right equipment and medications and resources that otherwise we'd be left to figure out all on our own. So that's just another great example, I think, of that layer of support and just that reminder that people come on to palliative care service and then they get better and they come off of palliative care service in many instances, in a lot of instances when they are seeking curative treatment. And so that is the overarching goal. And I think that's an important thing to remember when we talk about palliative care is it isn't meant or intended to be a very scary, ominous referral. It's really meant to be an uplifting layer of support for a patient and their family. Tatiana, can you please speak about the barriers that include the lack of awareness for child-focused resources? What are the things that you see hinder people from pursuing those avenues to support their kids? And not because they don't want to support their kids, but what are some of those holdups that you see?
Yeah, I'm going to echo Dr. Yao and Diana. There is a lot of overwhelm right at the beginning with so many appointments and just that overwhelm. So that can be a barrier. Also, asking for help. It can be hard to ask for help. So that's another barrier we see. And then just lack of awareness in, that our service exists. So that's why I'm so grateful to be able to talk to all of y'all and share more about Wonders and Worries. One thing I always love to tell families and referring providers is when families are referred to us, they don't have to start treatment with us or start services with us right away. They can say, call me back in a few months when things are a little bit quieter. So I always like to share that with families and that anybody can refer a family to Wonders and Worries. If Dr. Yao refers a family, that's amazing. And if Diana refers a family, that's amazing. But you can also refer your friends or anyone that you know in the community that could really benefit from our services. So we try and make it as accessible as possible. And we, of course, love early intervention, which is why we love when Dr. Yao and Diana refer families to us. But we want to connect with families no matter the timeline.
Great. Yeah, it's so important that we know about these services. And really, it just seems like education for both the providers and the families is still one of the biggest needs and barriers to families accessing this holistic level of care. I'm hopeful that this important dialogue increases awareness about these collaborative resources and creates a gold standard of collaborative cancer care in Central Texas. And with that, I would like to move on a little bit and talk just really about practical advice for families. And Dr. Yao, what is one thing you wish parents knew when they are starting treatment?
Gosh, one thing. There's so many untapped resources. It's our job to inform them of these resources, and that they're not alone in the journey. I think a cancer diagnosis or any major medical diagnosis can feel very isolating, and they can feel like they're the only ones going through this at this given time. And that's not really the case. Lots of people are going through cancer and they're not alone. And, I just want the patients and family to trust us because we all come and do this every day because we care about them and we want to do what's best for them. And so they're not alone, and there are plenty of resources to help them through.
I think especially parents, we think we have to tough it out. We think that, we can't show signs of vulnerability or weakness. And so sometimes medications that will help with palliation of some of those symptoms, like pain and debilitating nausea, can cause a little bit of fatigue. And so the patient might be reluctant to take the medications to address that pain so that they can stay more alert and they can be more present. And that always makes me really nervous because pain is something that if it breaks that threshold, it's really tough to get back under control. And so I would worry about a pain crisis on the horizon where then we're talking about crisis management. I think with palliative care on board early, as we've been talking about, we're going to talk about that early, what things are to come, what things we could see happening. And if those happen, then this would be sort of the advice that we would give them. There are ways to titrate and manage some of those medications so that we're kind of maximizing that time so that they're having, quality time with their kids and with their families and for themselves as well. So I would say pain that's unrelieved would be something that's usually a red flag for me because I tend to see what's going to happen a little bit down the road, and we want to stay on top of that pain to prevent a crisis.
Thank you. Tatiana, could you just give us one tool that a parent could use to start a conversation with their child about cancer? And that seems like a really big question to me to ask. Like, it makes my stomach hurt a little bit to even ask it. And I know that this is so much of what you guys do is support parents in having these conversations. So could you give us one tool?
If it's okay, can I give you 2 tools?
Yeah, give us two.
Perfect. So wondersandworries.org, our website, is chock full of resources for families. And we have some information that is geared just towards this. We have information about explaining a cancer diagnosis to a child and how to kind of start that conversation, and just explaining illness to a child a little bit more broad. And I think those are amazing informational flyers that we have. And that's a great tool. I think that can be so helpful. The other tool we have is our helpline. Families can call our helpline and talk to a certified child life specialist if they want a little bit more of personalized guidance on how to have those conversations with their children. So I think those 2 tools are just so important.
Yeah, that's amazing to know it's out there and it's so accessible to families. There's no barrier to entry there. That's amazing. Okay, well, my final question to each of you, and I'll call on you, is if you could, in one sentence or 2, could you say what collaborative care really means to you? Tatiana, I'll start with you.
To me, collaborative care is taking care of the whole person and everything that is important to them. So their physical health, their mental health, and then of course their family's health and their family's mental health.
All right, Diana, let's turn to you.
To me, collaborative care is being aligned. We are very, very focused on what the patient's goals are. And so sometimes that means us getting aligned with their goals and getting everybody else on board or on the team aligned with the patient's goals.
Yeah, that's definitely something I've seen APC do really well. Dr. Yao, could you speak about what collaborative care means to you as an oncologist?
Yeah, I think it means a team approach. Not any one group can take good, comprehensive, holistic care of a patient and their family. I think it has to be teamwork.
Excellent. To close us out, I'll just say that curative cancer care isn't just about eliminating disease. It is also focusing on strengthening the whole family while the treatment is happening. And when oncology, palliative care, and psychosocial support are working together, families are not just surviving cancer, but they are learning to navigate it with more clarity, a little more stability, and connection, which is so important. And instead of all of these entities operating in their individual silos, you kind of have this concert of all these musicians working together. And that's, I think, a really beautiful thing to picture as a patient or a caregiver is thinking about that music is playing around you. And maybe that provides a little bit of a soothing effect. But I'm thankful to all of our guests, Dr. Yao, Diana, Tatiana, for joining this important discussion. And to our listeners, please tune back in because we have another panel where we will be discussing collaborative care in a non-curative cancer diagnosis. But thank you all for being with us today, and we'll see you next time.